morning, students. Welcome to today's session of Conceptual Gupshup. Today we have with us the pioneer of arthroscopy in India, the legend, Professor Dr. V.B. Bhasin, sir. Welcome to this show, sir.
Thank you very much. Thank you, Harpreet. Dr. Harpreet, thank you very much.
Sir had taken previously a talk in Conceptual regarding how to build a orthopedic career. So, Dr. Professor V.B. Bhasin still holds a very the image of how to do a clean, ethical, and evidence based practice in today's world. So, sir will just guide us on the problems, the anxieties, the stress of a practice in today's world, doing a orthopedic practice in a private institute. Over to you, sir.
Thank you, Dr. Harpreet. My previous talk was on how to get trained as an orthopedic surgeon. And it is important that we have a look at that talk. This part of the talk which I am going to give is after you have got adequately trained, how to deal with the problems which come when we start a practice. You must have a look at that first video where the link will be provided in this video. You can have a look at that link and see that how to get adequately trained. Now we will talk about when you start a practice, there is always a competition anxiety, stress, and other things associated when you are building up your practice at the start of your career. Adequate training, there is no substitute. There is only one way, or the way which we have talked in the previous video. But how to deal with the anxiety and stress of practice is what we will talk about it. So this talk is competition, anxiety, and stress of practice, why, how, and what to do. So we'll give a small, more of thought process which goes on. The practice dynamics is that the patient comes to you for consultation for advice. He has just come to take your advice. Somebody might have advised him already something. So you may be just a part of a reconfirmation. So that part is called consultation for satisfaction. Somebody has advised a particular medicine or a particular investigation or a particular type of a surgery. The patient needs to be reassured that whether yes, this is correct and whether this is the right way to go forward. He may come to you for his own satisfaction. He might have decided that this is the treatment he is going to follow. It is only for reassurance that he has come to you. The first one which I said, he has a problem and he genuinely needs advice for that. That is consultation for advice. Second one I told you is consultation for satisfaction. Or sometimes some doctor has advised him certain procedure about which he has not given him a very good outcome. So what the patient is looking for is a consultation for an alternate advice. Now this is where one has to be careful. He may be looking for an advice which suits his taste or what he wants you to say. Well, you must assess the patient independently and give the advice which the advice merits, not just what the patient wants to listen. So this is the alternate consultation advice which sometimes people do engage in because they have not got the advice they were expecting or wanting to hear. Then there is another part of practice dynamics is the patient wants a consultation and he knows that he needs surgery. Where he should get it done, what he should do, that is what he has come for an advice. So he might have come for advice for surgery. He might be wanting to do the surgery with you or with an alternate. So this is where you are wanting to make sure that you are giving him the correct advice, you are giving him the correct prognosis, not to just say a better prognosis so that he stays with you, but you give him the appropriate advice and prognosis. But at the same time, you would like that if you can do that surgery, you should be the person doing it. Okay. Now this is a little dynamic or a very multifactorial decision when the patients make. We will talk what influences the patient's decision in a little while later. But there is a very important influence which is there on patient's mind is the waiting room influence. Okay? Now, when the patient is waiting in his room, he is looking to find what others patient's experience with you has been. So it may not necessarily always be a verbal communication. Patient is observing the face of the patients coming out of after consulting you. Are they looking happy? They are looking smiled, they are looking confused, or they are maybe looking angry also. So that environment, just the look of the patient coming out from your chamber will influence the patient sitting in the waiting room area. This is one factor which is very important, which is not verbal, but patients do perceive it, that this doctor is coming out. Most of the patients are happy, most of the patients are satisfied, most of the patients are smiling. Well, then, or a satisfied look on the face of the patient is enough for the patients waiting in the waiting room to reassure that they have come to the right doctor. Another, lot of patients sitting in that waiting room will discuss with the patients sitting around you that what was their experience of treating with the doctor and what was the outcome of surgery. Some of the patients, they can make out that this patient has a brace or a plaster or a cast or has a sling, and they can make out that he has had a surgery. The patient might have come for a similar procedure, but he wants to talk to the other people waiting in that area, that what was your experience. So this is what is we call a waiting room influence on your practice. A satisfied, happy waiting room will always be a good asset to you. Now, this is not something you can consciously build. This is something you need to work on your knowledge, your skill, your standing, your surgical outcomes. They all decide this. But this is a factor which influences, and a happy waiting room is always a expanding waiting room. So be careful and be aware that this is an important influence in the dynamics of the practice. Now, every patient has a reason to visit your clinic. That reason can be word of mouth. You have a very good reputation, patient has heard your name, and by word of mouth, this is one of the best ways that a patient comes to you. He might have heard your name from surrounding areas. This is an advantage of practicing in our country. Whenever I am treating a person in a locality or in a particular area and he has had a surgery, all his relations will know my name. Whether the patient becomes good or the patient becomes bad, all will remember my name if I am the surgeon. At least 3-4 houses around will know probably my name. And maybe 10 houses on either side will know that the name of the hospital this person went to. Now, this is where our society is, and it has an advantage. In Western countries, most of the time the patient does not know the name of his doctor because he has been sent there by the insurance company. In our country, it is the word of mouth, which is the most important, whether it is good or bad. But it is an important factor why the patient comes to you. Whereas in the Western world, it is the local general practitioner of that area will direct all the patients from that area to a particular hospital, which is the procedure there. It is nothing much, but it is the way the system has been built. Our system, we have close ties with our friends, families, and with our neighbors to some extent, maybe lesser in bigger cities and more in smaller cities. So this is how a dynamics of practice is influenced by word of mouth. Anybody who have previously operated, any of his relations who know that he has had a satisfactory outcome will definitely want to come to me for opinion or maybe for surgery also. So this is the second category, which is definitely more stronger belief in your capabilities because he is coming with a preference of a surgically operated patient. Nobody anywhere in the world just gets surgery done without asking. They all consult, reconsult, decide, rethink, definitely get opinions and then go ahead. So once they have gone through that filtration process, then only, and the person who has already gone through this filtration and is satisfied is probably your best ambassador. Another reason that a patient may come is you are working in an institution which by and large has good reputation in that area or in the area surrounding draining area, then also the patient comes. But this is based on the name of the institution, it is not directly your name. So it is not a very strong reason that the patient has come to you, but definitely he associates your working institution with a good ethics. Another thing which has started occurring now is an internet search. Now, this was not occurring, and I was even not aware that people who are coming even to me for surgery have watched my surgical videos at multiple areas. Some of them are so well informed that what I do, that they come and tell me and ask me that do you do it this way? I also get sometimes surprised. Probably in this era of information overload, people are accessing the internet to get a good idea of where they are going. I believe that some of the conference proceedings, some of the webinars proceedings are available for general public, and I know people have seen it because sometimes they tell me, I ask them, where have you heard that I do it like this? They say, you are giving a lecture at a place where 3-4 people are sitting behind you and 200 people sitting in front of you. We saw that video. So this is an important area which is occurring now. So having a good internet footprint is important in present day times, and probably it will become more relevant in times to come. Now this is different than word of mouth. Now word of mouth, I said, people surrounding you, somebody hears you. But hearing it on the internet, who will use it? Now somebody who does not have word of mouth reference, he will use internet, or the two may be combined. That he has a word of mouth and then he searches for you on internet and then gets an idea. Now internet ideas are people. Another thing which is happening is that if let us say I am a daily resident and now I am working in Pune, I may not know anybody in Pune. There I will go first for the internet search. In other areas, people will ask their office colleagues, their family members. But if I am new to a city and I have to look for a doctor in orthopedics, probably I may do an internet search. So having a good internet footprint will probably become relevant there. Internet search and word of mouth may both be combined. So this is another area one should be aware that this has started occurring nowadays. Another reason for patients to visit is that there is an organization like Indian Oil or big companies. They have got their physician. They will refer their employees to a particular institution or to a particular doctor, depending on what their internal dynamics is. So this is another reason why patient visits you is reference from their organization they are working. Another reason why people get patient is marketing directly or indirectly. Maybe directly involves some incentives. This type of a practice probably is not a very long-standing and very stable way. And once you get into this type of a work, it is very difficult to get out of this work. Okay? Indirectly, marketing is you are giving talks, you are giving web lectures, you are doing conferences and workshops. That to some extent makes people aware that this person is involved, not directly for the purpose of marketing, but it indirectly markets your self. Direct marketing with incentive is different and probably not a very good method of working. But indirectly, if you are doing good work at a conference, association, workshop, camps, seminars, that helps like a indirect marketing. So these are the various reasons, and you can address these various reasons when you are building up your practice appropriately. Now another thing, a patient comes to you for opinion, he may need surgery. What makes patient stick to you? We assume that you have capability to what you are to do, the surgery you are advising. Capability part is the part which was dealt in the training video, which is what I referred in the beginning of the talk. But why a patient sticks to a particular doctor is a very complex issue. Every patient has a personality. Every doctor has a personality. Where the two match, that is where the gelling occurs, and that is where the two have faith and follow up with the treatment in future also. Otherwise, when they don't match, then probably patient has come once and may not be coming to you again. So having a well-rounded and no sharp likes or dislikes, no sharp talk of strong dislikes on likes when you are talking to your patient is a good advice. The more rounded the personality you have, the more patients will be comfortable talking and discussing to you. And one of the best methods of finding out what the patient's personality, his thought process, his lookout is to listen to the patient. Listening has two advantages. One, when you listen to him, you understand his problem better, and just the fact that you are listening to him makes him feel good that you have tried your best to understand his problem, not cut him short. Okay, yes, I have understood, and this is what you need to do. So listening to the patient for a reasonable amount of time. Don't be unreasonable. Some patients are unreasonable, and then you will realize when you are listening to him that he is in unreasonable details describing himself. And you will be able to catch it once you listen to him for first 1 or 2 minutes. So patient may say that I had this back problem for which I took homeopathy, I took chiropractic, I took hot fermentation, and that is what his thinking is. Now this type of a patient is most likely looking for a similar line of treatment, not immediately a surgical line. Unless surgery is necessary and there is no other alternative, and that's an absolute indication, only then should you advise this patient a surgical option. Otherwise, what he is looking for is what he felt like doing on his own. So he has to be guided in that direction. But of course, the advice must be meritorious. Your advice should not be harmful. Your advice should be beneficial. That you have to be sure about yourself. So listening will not only provide you with patient's complaints in a better understanding, it will also provide patient a satisfaction that you have tried to understand the problem, and at the same time you will come to understand that the personality of this patient. Some people who start talking in big details, it is best not to question too many times. Every time you will question, you will get a very long answers and imprecise answers. There your question has to be precise, limited number, but not too many questions. So you will only understand this once you start listening to the patient, that what is this patient's personality, what is his expectation, what is his line of thinking. Okay, so this is what I called a patient doctor compatibility, which is where the patient sticks and follows up with the treatment. A very important line one must remember is stress is a function of expectation. In Gita it is said, karam karo but phal ki ichha na karo. Now it is very difficult for everybody to understand ki why should I work and not expect a reward. The way to understand this line from Gita is phal ki ichha mein karam na karo. That means you don't do your job for the sake of reward. You do your job because you know how to do it, you know how to do it well, and do the job just for the purpose of doing the job, not for the purpose of getting a reward. Okay, so this is the difference in doing a job for the purpose. Just you must enjoy the job which you are doing. It is said that aim is not the reward, aim is the path. Lot of people have said it, that the path is the aim and you must enjoy the path and do the path well. If you do a very difficult surgery, at the end of it, what you feel is typically a delightful fatigue at the end of a successful struggle. That delight and the joy takes away the fatigue. Okay, so stress is a function of expectation. Never have expectations or attachments. Only you should be able to say that you can do a job. There are many lures of practice. All these are traps for such stress. I always say that treatment is patient's requirement, and you happen to be one of the persons qualified to provide it. Our Creator has made all of us capable of doing what we want to do, what we wish to do, what we work hard to do, and we want to achieve. This is our Creator's capability. Everybody has the capabilities to do it, provided he has worked hard and provided he has trained. Thinking that only I can do it and nobody else can do it is a disrespect to our Creator. Okay, so as I said, there will be a lot of lures. Lures will come from pharmaceutical companies. Lures will come from instrument manufacturers. Lures will come from incentives from hospitals. If you fall into all these lures, you will definitely be ending up with the stress. I am not saying financial management is not important. Financial management is very important. You should not be ending up in a financial situation which is not to your liking. That itself will add to a stress. But one must understand that for the purpose of financial requirements, you should not be providing advice and treatment. Treatment should be patient's requirement, not your requirement. If the treatment becomes your requirement, certainly if the patient decides to go away or go to another place, or he comes to you and is not satisfied, you will be under stress. So if you say that treatment is my requirement, you may sell patient an outcome which is better than what you can provide. Again, it will lead to stress to you and patient will be not satisfied. So make sure that patient needs the treatment and you happen to be one of the person who the Creator has given the capabilities to provide it, so that you don't fall into different lures. Definitely you should look at all financial aspects. But if you do treatment for the purpose of these lures, that is not what will be a very happy outcome or a comfortable way for you. Another thing which is occurring is conflict with the society. It is a dilemma of modern medicine and advances. All the advances which are occurring in the medicine science involve use of certain implants, certain procedures. They all have added to the cost of treatment. We are all trained and we all look forward to the West, that this is the way we have to follow. West, with its vast resources, has not been able to look after all its own population. How can we, working in our country with limited resources and a huge population, look after our population if we strictly follow the model provided by the West? As I said, some of the advances in the Western world which are coming and percolating to our country are purely driven by commercial interest. They are scientific, but the science has been made attached to some type of a commerce. Now, it is not that we should not be doing modern advances. We have to keep up with the modern advances. We should be scientifically aware, but we should at the same time understand that can our society afford such a cost? We should know that we have to look after our society. If we look after our society will look after us. That is where most of the problems when the practice people get is that the expectation goes up, the cost is going up, so the cost goes up, the expectation goes up. And if the return is not that much and patient could not have afforded it but did it, that will lead to a conflict. One must do proper medical advice, correct advice, correct judgment, not just because it is a newer advances. Definitely look at newer advances, definitely try to follow it, but one must look at the type of population you are dealing. I am not saying to give inferior care, give same care, devise your own methods, which is surely possible to devise own method based on scientific principles for you, which your society can afford, which your society can take care. This way you will have lesser conflict with the society, because our society has our resources. What we tend to follow is a Western society with higher resources but lower population. We must understand and address this point. Recently, there has been talk of providing more doctors by non MBBS doctors to provide them facilities like this. Why is that occurring? Because our way of working has not been able to provide to the largest section of society. We have to look us at ourselves so that we can devise treatment protocols and methodologies which will look after the largest section of our society. A large part of our society remains without medical care because we have followed the elitist Western model. I am not saying don't look at scientific advances, definitely follow it, but definitely try to temper it to what your people can afford. So, this is what I called socially relevant scientific practice. Practice based on good scientific principle, but which should be socially relevant. And if we practice this, definitely we will be giving in the right direction. One of the songs I need to remind you, must have all heard about it. This is a song which says, मैं पल दो पल का शायर हूँ, पल दो पल मेरी कहानी है. Now you substitute the word शायर with yourself. मैं पल दो पल का औरतों हूँ, पल दो पल मेरी कहानी है. We know all. पल दो पल मेरी हस्ती है, पल दो पल मेरी जवानी है. मुझसे पहले कितने शायर आए और आकर चले गए, कुछ आहें भरकर लौट गए, कुछ नगमे गाकर चले गए. मुझसे पहले कितने ऑर्थो आए, कुछ ओपीडी प्रैक्टिस, कुछ सर्जिकल प्रैक्टिस, कुछ बिना प्रैक्टिस के आए और चले भी गए. किसी की प्रैक्टिस ज्यादा है, किसी की कम है, बट दिस इज वे और पार्ट ऑफ लाइफ. वो भी एक पल का हिस्सा था, मैं भी एक पल का हिस्सा हूं. कल तुमसे जुदा हो जाऊंगा, वो आज तुम्हारा हिस्सा हूं. एज आई एम पार्ट ऑफ इट, वन डे आई विल नॉट बी देयर, बट द वर्ल्ड विल कंटिन्यू, बिकॉज दिस वर्ल्ड इज मेंट टू लास्ट. Whatever may be the situation, whatever may be the pandemic, whatever it is, this world is meant to keep going on. कल और आएंगे नगमों की खिलती कलियां चुनने वाले, मुझसे बेहतर करने कहने वाले, तुमसे बेहतर सुनने वाले. So how do I interpret this line? कल आएंगे नगमों की खिलती कलियां चुनने वाले, मुझसे बेहतर कहने वाले. How you interpret? मुझसे बेटर सर्जरी करने वाले भी कल आएंगे. मेरे से पहले थे, इट हैज इम्प्रूव, वी ऑल हैव इम्प्रूव, दिस इज वे द लाइफ गोज ऑन. मुझसे बेटर करने वाले भी आएंगे और तुमसे बेहतर सुनने वाले, ट्रीटमेंट करने वाले पेशेंट भी और भी बेटर आएंगे. कल कोई मुझको याद करे, क्यों कोई मुझको याद करे. वी ऑल हैव टू रिटायर एंड फेड अवे. Nobody remembers anybody for many years. मसरूफ जमाना, द वर्ल्ड इज बिजी इन इट्स ओन सेल्फ एंड इट इज बिजी टू इम्प्रूव द वर्ल्ड. मसरूफ जमाना मेरे लिए क्यों वक्त अपना बर्बाद करे, मैं पल दो पल का ऑर्थो हूं. दिस रिमूव्स ऑल द अटैचमेंट्स यू कैन हैव विद द पेशेंट. You are only to do the job as for the time and the date at which you are there. This removes the attachment that you can have. All the stresses comes because of attachment to whatever you are doing. If you are in a detached function, then you will not get anxiety or stress, and you will work appropriately and to a good level. Thank you.
Wow, that was great talk, sir. Great guidance for all the budding, not only the students, the working orthopedic surgeons also. That each patient is important. A satisfied patient will build up your practice, will lead to a satisfied waiting area. Also, that listen to the patient, never interrupt. So I read somewhere that there was a research that average time a doctor listens to the patient without interrupting is just 12 to 15 seconds. So that's how fast we interrupt them, we jumping to
Yes,
conclusions
yes, yes.
from their complaints. And so it important is to listen to the patient and not to fall into the lures of practice, because if you fall into that lure of that and have a stress, then
Corporate
you
hospital.
for material requirement. So you remember this line from sir's talk, that treatment is patient's requirement. वो पेशेंट आपके पास आया है क्योंकि उसको ट्रीटमेंट चाहिए है. यू डोंट ऑफर अ ट्रीटमेंट बिकॉज यू वांट टू डू दैट सर्जरी. The surgery has to be appropriate to patient's requirement, his expectation. And we also got to know that there's a poetic side to sir's life. He listens to songs. Do you often listen to songs, sir?
All my operation theater, the songs are playing.
Okay.
And one of the songs which I just read out the lyrics was, it always comes and plays. And I tell my colleagues who are assisting me that remember this, tomorrow there will be people doing better than what I am doing at the moment. There were people before me. Sometimes my junior interrupt. Before you, there were not people in this type of field. They interrupt at that time, but I said no. There were people, and there will be people.
So this is one of your favorite songs?
I do like to listen to it. It is part of there, but it depends on
Yeah.
the type of surgery. The songs are playing always on the speaker with the pen drive, so it keeps playing anyway. So this is one of the songs, and this is one of the songs probably which tells you that you have to work at the moment, and think at the moment, not think beyond that. Maybe this gives a good philosophy, and just substitute that word shire with ortho.
So live in the present.
Yes, live in the present. So one of the things of which I think I probably missed out is layers of corporate hospitals providing you an incentive more than what you can do. That has started occurring. And probably you should be aware that these types of layers are also adding to your working. If they start influencing your working, it is not a good idea. Look after your finances. That I am not saying. Make the best finances. Make the best you can do. But getting trapped into achieving a minimum target is not the way medicine is to be practiced, at least.
So enjoy the path. Don't think that I have to reach there. Just enjoy the path.
Correct.
Do good work, ethical work. Sir, there's something I want to ask you. In my practice, I often face with a dilemma that a patient has been advised some surgery or has undergone a surgery, which I think was not appropriate for him or has caused a complication, and that has been done by a colleague or some other person, and how to deal with it without um, bad naming my colleague, or how to
Right.
deal with that situation, how to tell the patient that this is something has gone
Okay. So
bad.
there are two questions you have asked. One is that probably that surgery has ended up with a complication. We are all dealing with situations which are always not exactly duplicatable. Every accident, every injury is different. So what I normally believe, unless there is a big reason not to believe, I believe that that person did the best what he thought at that time, what his capabilities was, what his setup was. So I always tell them that I was not present at the time of your acute problem. He at least got you out of the acute problem. Now, these types of problem could have occurred anywhere. Unless it is something grossly wrongly done, that's a different issue. There you don't have to defend, but you can always say that this needs to be improved. But as I said, the person who saw him first probably did it in the best interest, best of his capabilities. That I always tell. That I was not there at that time, but at that situation, at least you have come out of it. Some of the road traffic accidents, they can be really bad. What you are seeing today is much different than what it was. Patient's expectation is that he was absolutely fine just before the accident, and he should be absolutely fine just after the accident. So some of them, he says, I'm not as normal. I said, so I always tell them that obviously you have had an issue, and everything keeps changing every day of life. Every day of the life cannot be same as what it was yesterday. And everything in the life cannot be predicted. A lot of people come and ask, what will be the outcome after 5 years? I give them a classical example. I said 1 year ago, all of the intelligence of the world could not predict that we will be in a pandemic and the situation will be this. There will be no flights, people will have no jobs, people in tourism, travel industry will be nowhere. I said, how can 1 year ago the entire world intelligence could not predict, and you are wanting to predict what will happen to you 5 years or 10 years down the line? So these types of things have become a little easier with the pandemic because the world understands it now. Okay. As far as complications are concerned, this is what I would say. Now let us say something unindicated has been done. Let us say. Now you cannot undo it. But there is this what you have to say. You just have to say, so far as the patient has not been harmed to a major limit, but he continues to have some symptoms. Classical example, let's say patient has a disc surgery. Now disc surgery classically has three definite indications: urinary restriction, paralysis, worsening symptoms, or all these things. But let us say patient had none of them, just pain was there, and it was there for 10 days, and he has undergone a surgery. This is what will happen. The patient will still complain of pain in the back. So what do you tell the patient who has had this type of situation? You tell them that even if you don't do surgery, you will still continue to have back pain. Your leg pain should improve. So this is what you have to tell them, that this is what can occur, or better still, tell them to focus on what is to be done further. If somebody is very persistent in trying to provoke me or poke me into it, I always say that we can live what I can always think more what is to be done for you now. If you want me to spend the time allotted to you for thinking, for answering your questions, what was done to you earlier, I will not be able to guide you further what is to be done, and what matters to you is what you need to do further. That is how you address people who are very persistent in trying to provoke or poke you into this.
So remember, important is what's to be done next. So
Yes.
important to also guide the patient,
Yes.
that we cannot undo or nothing can be done about the past, but yes, your future can be made better if you focus on that.
Correct.
So thank you, sir. Thank you for guiding us through this important topic where we just learned that how we need to stay in our practice, how to not fall into the layers of practice, and how to maintain, build a ethical, clean, evidence-based practice. So keep learning and keep teaching, sir. Thank you.
Thank you.